This question comes from Mount Pearl, Newfoundland. I know there are several medications that cause a heightened skin sensitivity to UV exposure. Is this the case for nails as well? Yes. If you're using a medication that heightens sensitivity to UV, you could have an increased skin reaction with a UV nail lamp. Now, the nail plates themselves are not typically adversely affected by UV, but the skin is more easily burned while using medications or these kind of treatments. This is called a photosensitivity, and it can lead to a skin irritation or an allergic reaction. Photosensitivities can happen with medications taken orally or those that are applied topically. Now, the most well-known example is the antibiotic tetracycline, but there are several dozen medications that can cause these kinds of UV sensitivities. Typically, the skin will react within minutes. Sometimes the reaction is delayed a few hours. Often the reaction will appear as exaggerated redness or swelling, and even blisters can form, and of course the skin can become very itchy. The reaction isn't always isolated to the area of exposure, and even adjacent unexposed skin can display these symptoms. Of course, wearing sunscreen or covering the hands with a cloth or a UV protective shield can help minimize exposure. I've talked about the usefulness of these shields in previous episodes. You can find this information using the Instant Answers feature on my website. Now, I hope you've tried it out. The feature is pretty awesome and it's really easy to use. You can search for instant answers to any of the more than 200 questions I've answered so far. But for advice that involves medication, it's always best to ask the prescribing physician. In these cases, the doctor will most likely advise their patient to skip such services until they've completed taking their medication. Better to be safe than sorry, as the saying goes.